Welcome to this explainer. Today, we're diving straight into the exact medical science and pharmacology behind acne treatments. We're going to look at the biology of what's actually happening under the skin and then explore the molecular heroes designed to stop it in its tracks. So let's get right into it. Now, you might be wondering, why exactly do pores get clogged in the first place? And how does medicine actually clear them out? Well, by the end of this explainer, you won't just know the names of your medications, you're going to understand their exact biological missions. Here's our roadmap for today. 1. The 3 causes. 2. Retinoids. 3. Antimicrobials. And 4. Hormonal therapy. We're going to identify the biological villains first, followed by the specific chemical heroes that actually defeat them. Section 1. The 3 causes of acne. Every single breakout follows an exact sequence. First, there's an overproduction of sebum, which is driven by your genetics and hormones. Second, we have follicular hyperkeratinization. That's a big word, but basically, instead of shedding normally, your dead skin cells clump together. Now, combine that excess oil and dead skin, and you get a microscopic plug called a microcomedo. And in this airless, oily little environment, our third villain absolutely thrives, the P. acnes bacteria. This is what triggers the inflammation we see as blackheads or whiteheads. Section 2. Retinoids unclogging the pores. Think of retinoids, which are derived from vitamin A, kind of like a biological lock and key. Here's how it works. Retinoic acid enters the cell and is shuttled right into the nucleus by a protein called CRABP. Once it's inside, it acts as the key, binding to RARs or RXRs receptors. This binding activates transcription factors that actually force the epidermal cells to shed mature and dead skin cells. By forcing this rapid turnover, the pore literally physically expels the clogged material. Pretty cool, right? So this brings us to 2 main battle strategies. Topical retinoids like tretinoin, adapalene, and tazarotene versus oral retinoids like isotretinoin. Topicals are applied directly to the skin for localized shedding, but oral isotretinoin, that's an entirely different beast. It has the incredibly powerful ability to actually shrink the sebaceous glands themselves, drastically decreasing oil production and starving that P. acnes bacteria right at the source. However, these medications act as a double-edged sword. Topical retinoids commonly cause local irritation, things like dryness, swelling, and sun sensitivity, but oral isotretinoin, because it is so systemic, carries severe risks. We're talking mood changes, bone pain, and GI disorders. And most crucially, it causes severe birth defects and must be absolutely avoided during pregnancy. No exceptions. Section 3. Antimicrobials, fighting the bacteria. Now, antibiotics are the classic choice here, working by effectively starving or disabling the bacteria. Some of them block tetrahydrofolate biosynthesis, which starves the bacteria of the building blocks it needs for DNA. Others go in and disrupt the bacterial ribosome to stop protein synthesis altogether. Whether they're topical or oral, think sulfamethoxazole, trimethoprim, clindamycin, or doxycycline, they halt the bacteria's growth and really reduce that inflammation. But here's the catch. Overuse antibiotics and bacteria mutate. They build resistance. Enter benzoyl peroxide, which bypasses resistance entirely. Remember how we said that P. acnes thrives in an airless pore? Well, benzoyl peroxide enters that pore and literally floods the environment with free oxygen radicals. The anaerobic bacteria just can't survive this oxygen shock and dies from direct toxicity instantly, all while speeding up skin cell turnover. Section 4. Hormonal therapy, regulating the oil. To really understand these therapies, we have to look at the sebum production pathway. Inside our sebaceous glands, sebaceocytes take a weak androgen hormone called DHEA and run it through a sort of metabolic assembly line. It converts to androstenedione, then testosterone, and finally into the incredibly potent dihydrotestosterone. When these androgens spike, like they do during puberty for instance, this whole system goes into overdrive, flooding the pores with oil. Our first hormonal hero here is spirolactinol. Think of spirolactinol as a highly effective bouncer of the door of an exclusive nightclub. It physically acts as a blocker for the androgen receptors within the sebaceous sites. So even if testosterone levels are high in the body, spirolactinol stops those hormones from actually activating the cell, effectively shutting down that sebum proliferation. It is a real game changer, though it does come with potential side effects to keep in mind, like increased urination and irregular periods. Okay, before we get to our final treatment, we need to understand a crucial protein called SHBG, or sex hormone binding globulin. Basically, think of SHBG as a sponge in the bloodstream. It's a protein that regulates hormones like testosterone by binding them up and making them completely unavailable for cells to use. This mechanism is incredibly important for stabilizing the changing hormonal levels that trigger breakouts. So, to stabilize those hormonal fluctuations, oral contraceptives deploy a brilliant triple threat mechanism. First, the synthetic estrogen in the pill, like ethinyl estradiol, massively boosts the production of that SHBG sponge we just learned about. Second, it suppresses luteinizing hormone in the pituitary gland, which tells the ovaries to produce fewer androgens in the first place. And third, it inhibits 5-alpha reductase, the specific enzyme that converts testosterone into its most potent form. When combined with a low androgenic progestin, like norgestimate, oral contraceptives aggressively neutralize the hormonal triggers of acne. Of course, altering the body's natural reproductive cycle requires careful consideration. The physical trade-offs of hormonal therapy can include nausea, headaches, breast tenderness, breakthrough bleeding, and weight gain. There's also an increased risk of blood clots. It's a systemic treatment, so it really requires balancing those clear dermatological benefits against these physiological side effects. All right, let's tie it all together. We started with 3 biological villains: clogged dead skin, bacteria, and excess sebum. And we countered them with 3 drug classes. As you can see, retinoids target the skin cells to physically unclog pores. Antimicrobials toxify the bacteria and stop growth. And hormonal therapies block receptors to shut down oil production right at the source. It's an incredibly elegant pharmacological web. Medical science has brilliantly reverse-engineered the pathogenesis of acne to give us these 3 core therapies. But as our understanding of molecular biology continues to evolve, what new targeted therapies might we discover to intercept the acne life cycle even earlier? It's a fascinating frontier for sure. Thank you for exploring the science of clear skin with me today in this explainer. Keep asking questions, and I'll catch you next time.